most famous physical therapist on the internet.
Hi, folks. I'm Bob Schultz, physical therapist.
Brad Heineck, physical
Going
therapist.
to be the most famous physical therapist on the internet.
In our opinion, of course, Bob.
Hey, Brad, we're going to talk about rheumatoid arthritis.
Mm-hmm.
Do you have it? You must see this video for signs, symptoms, and treatment.
Right. This
So-
is one of those things that, I don't know if it's my age or what, but I've been seeing more and more friends, family members, and patients with the diagnosis. It's like, I didn't know enough about it, so I was like, I want to get some more details.
Time to get some information and
and
education.
share it with the viewers.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media channels and probably even our website, bobandbrad.com, because we're always doing a giveaway. Right
There
now,
you
we're
go.
giving away the RENPHO self-massager,
There you go.
cordless massager, handheld massager. You can also go to Facebook, Bob and Brad. It's pinned to the top of the page. This is a nice massager, Brad.
Oh, yeah.
I mean, for the price, for $40. I mean,
Right.
I mean,
Yep.
most of these are like $100. So
Right. And it's reciprocating. It's a good value.
Percussing.
Right.
Yeah. All right.
Reciprocating. Percussing? Well, I thought it was the same.
Reciprocating saw, isn't it?
Anyways, let's
okay.
go on with rheumatoid. So, like I had mentioned, Bob, and what really got me going on this is, we had a guest speaker about a year ago
Right.
on rheumatoid. A family member of mine just got diagnosed with it, and actually another one. And then, over the years, you see it with patients. And a lot of people are wondering, like right now, I have
Arthritis.
stiffness in my
Right.
fingers. I get up in the morning, it's like, and particularly one of my finger joints is really stiff and it gets painful. And I'm wondering, maybe it's RA.
I do notice that's your middle finger, by the way. It's not being overused, is it?
Bob, this is a family show. Let's keep it intact.
All right.
So
Well-
anyway, so what is rheumatoid arthritis? Let's get right to it on
Sure.
that point. It's a chronic disease. And the difference there's quite a few differences between rheumatoid and your typical osteoarthritis. Osteoarthritis is like someone who has a knee replacement or a hip replacement.
Yeah, it's just a wearing out of the joint,
Right.
basically.
And it's, one or two joints.
Like, it can be single joints,
Right.
although there's ones that are predominant.
Exactly. A lot of weight-bearing
A
things.
lot of weight-bearing
The
joints.
big difference with RA, it's a systemic problem.
Right.
It's an autoimmune disease. In other words, your body
is attacking itself.
exactly.
Yeah.
So it's one of those things that if you have it, you need to be aware of it, and because there's things you can do. We're going to talk about near the end of the video on how to
by
take care of it.
systemic, we mean it's affecting your whole body.
Right.
It's not just affecting the joint. You're going to maybe even feel fatigue and stuff like that because of,
Right.
of it. So
And we're going to get into those symptoms as well,
Sure.
too. So who has it? What are the statistics on who have it? Most commonly diagnosed with people at the ages between 30 and 60,
interesting.
which
I didn't
realize it
No, I
was
didn't
down
realize
to the
that either.
30s. But so, that's that was interesting. And also, there's 3 times more females
Right.
than males that have it.
And I was aware of that only from the fact that, I mean, almost, to be honest with you, the vast majority of ones I see are female.
Sure.
I mean, it's just.
You mean in the clinic?
Yeah, I can't even remember too many men that have had it. But
Right. Well, it's
so-
3 to 1. So some of the symptoms. Now, these can vary to degrees, but these are common ones. Joint pain lasting greater than 6 weeks. So it's an ongoing pain.
and probably multiple joints.
Right.
Quite
Exactly.
often,
It's
right.
oftentimes.
Oh, I'm sorry. I'm jumping ahead.
Yeah,
That's
don't
what
worry, Bob.
So-
It's fine to repeat things
Yeah.
because things come and go in our mind. So a little
Afraid it does.
repetition at our age is helpful, and oftentimes morning stiffness, getting out of the bed, is very uncomfortable. Reports of people with their feet and being very painful when you put weight bearing through it, and if it lasts longer than 30 minutes, that's another
So
potential
that
sign.
morning stiffness lasts more than 30 minutes.
30
Because
30
you're
minutes.
going to have stiffness with a lot of arthritis joints. Osteoarthritis too.
Exactly.
But yeah, generally as soon as you're up and moving, it gets better right away.
But this lasts longer than 30
Sure.
minutes. And it's, again, multiple joints, oftentimes some of the smaller joints in the fingers. There's actually a diagram you can find, and it'll show the most common sites, but it is throughout the body.
Most common joints.
Yep.
Okay.
Another one is there can be lumps under the skin, oftentimes in the fingers.
Okay.
And then
Those aren't the Herbidin nodes. I think those are more with osteoarthritis. These are, do you know location-wise?
No, well, more commonly in the fingers,
Okay.
but they can be other places as well.
Okay.
And again, like I said, general fatigue
Right.
is one, and low-grade
Yeah,
fever.
that's probably one of the bigger indicators to me is that
Right.
that general fatigue that you just don't have to get up and go.
Right.
It got up and went.
That
So-
being said, and of course, it comes and goes. People who have RA, they talk about flares.
Sure.
And they'll just flare up where it's just painful just to get out of bed and just walk. And it's not just for 6 o'clock in the morning, but it can be throughout the whole morning up till noon, that kind of a thing.
Sure.
It's not easy to diagnose necessarily. So just, if you're listening to this video and you have all of these symptoms, and you think, oh, I must have RA, it's not that easy. You need to go to a doctor, and the doctor's going to take a medical history, look at your past. They're going to take a physical exam, look at you right in front of them, and do a good physical exam. Then a blood test, and there's a number of things that said right. There's about 2 or 3 different indicators that they'll look at for that. And then possibly scans for your joint and see if you have some actual joint disease. Because this autoimmune disease attacks typically joint tissue. And it can be permanent. If your joint is damaged by RA and it's to a certain degree, it's not going to get better from what I find.
And you definitely do want to get diagnosed because, and you're going to talk about some of the things, the treatments, right? But
treatment options that are available. And the first one, I wouldn't say this is the first. It depends on the person. Is medications. There's a number of medications. Now, the bad thing about the medications, there can be some bad side effects.
Sure.
The woman that we had on.
Yeah, that's right. She mentioned the side effects right away.
Right. If you Google
disabling, weren't they?
Right.
Yeah.
If you Google Bob and Brad, RA, rheumatoid arthritis, that should come up right away. And hers, it was very severe. And actually now I know her. She is going with no medication. She treats through diet primarily, and quite successfully. So that's been working out.
And that's what you mentioned as your second treatment here is the diet.
Right. And I think that's pretty much across the board, as well as our third one. But you need to make diet changes. Anti-inflammatory foods.
The more you read about this, Brad, the more you realize that you can actually use foods almost as medicine.
Right.
In a lot of instances. And I'm a big believer. I read the book How Not to Die, and it talks a lot about that.
Right.
Rheumatoid arthritis.
And you're still here, so the book must work.
That's right. I'm still kicking.
Yeah, we'll keep a little light-hearted note on this. And of course, the third one, which we know is very important as therapists, is exercise.
Sure.
The thing is, you need to exercise smart. There's certain, you're not going to go lift heavy weights. You're not going to go run a 5K as fast as you can, type of thing. But some aerobic exercise, and everyone's going to have different exercises that may be good for them, depending on what you like to do, what your body tolerates, which joints are affected.
But really try to keep moving.
Right. You really need to keep those muscles moving, get those joints moving.
And you may have to deal with it. During flare-ups, you may not be able to exercise as much or even at all.
Right.
But as soon as it calms down, get back to it.
Right.
So.
Right. And I don't know if I mentioned this before, but there's a woman where I swim, and she's got arthritis, and she's very particular. She'll let you know, if you're swimming by me, do not touch me.
Oh, really?
Yeah, because if you're swimming, your arms go over and you bang hands. It hurts just without arthritis. I can just imagine with our arthritis, if you, I call it a hand kiss.
Sure.
If you get one of those when you're swimming, it's just extremely painful.
I'm not a swimmer. I didn't realize there was these things going on, Brad.
Well, if you're lap swimming, a hand kiss can be painful.
All right. You didn't meet your wife that way, did you? I mean,
no, Bob. I should have known something like that was going to happen. So, again, these are the things you really need to know, but you really need to see a doctor to get diagnosed properly, and then research the options for treatment, and do
ask
what
your
works.
doctor about diet.
Right. Some doctors are going to go to it.
Yeah.
Some are going to say they focus on the medications.
Exactly.
So you got to get the right doctor for you.
Yep.
So
very good.
Good luck with it, and take care.
Thanks, Brad.